retire early, will my healthcare costs go up?
Well, that sounds like maybe a company specific question, but in general, I think you can expect to spend more if you retire early, right? So I talked about the importance of doing some planning, and the key component is the healthcare aspect of retiring in your early to mid 50s, as an example. So I guess the answer to the question technically is yes, because you can expect to spend more. Because by definition, someone who retires at 55, for example, has a 10-year window before Medicare is going to kick in. That could potentially have some ancillary benefits because maybe your employer gives you some supplement to your Medicare supplement plans that you otherwise would have had to pay for. So the answer is yes, you can expect to probably spend more money. And the beauty of doing an analysis is we can segregate some additional expenses over and above what you're currently used to or accustomed to spending. So, for example, let's say you're spending $1,000 a month for healthcare premiums for you and your spouse. Okay, we put that in the budget, but then we also advocate that you have a different line item for additional potential expenses that you're unexpected. So, for example, we can incorporate another $1,000 a month because there's added expenses that you didn't know you were going to have before you reach 65 from a medical perspective. And so we can stress test that both with and without in retirement, so you can see what that does to the impact of your overall assets 5, 10, 15, 20 years out. So I think the most and safest thing to tell you is yes, you can expect those expenses to be higher if you decide to retire early.